The health system in the U.S. is a complex and dynamic topic that has been subject to extensive studies and analyses for many years. In many ways, the development of the health system in the U.S. has been characterized by conflicting trends and political priorities, leading to significant challenges in terms of accessibility, quality, and cost-effectiveness. In the years following World War II, the U.S. was considered a global leader in healthcare, with high standards of living, advanced medical technologies, and an extensive healthcare sector. However, since then, the development has been characterized by increasing awareness of various health problems, including the rising prevalence of chronic diseases, increased overuse of medications, and problems with access to healthcare for many parts of the population. One of the most notable trends in healthcare in the U.S. in recent decades is the increase in the prevalence of chronic diseases. Such diseases, including diabetes, cardiovascular disease, and cancer, have increased dramatically in the U.S. and now represent a significant proportion of total healthcare spending. This has led to increased costs for both patients and the healthcare system overall, and has also focused attention on the importance of preventive measures and early detection and treatment of disease. Another important trend in the healthcare sector in the U.S. is an increase in medication use. Many Americans now take multiple medications at the same time, and there has been growing concern about the possible side effects of such medications. This has led to increased attention on the need to limit overuse of medications and improve patient education on how best to use medications safely and effectively. Another challenge in the American healthcare system is access to healthcare for many parts of the population. While the U.S. has a high standard of medical treatment and technology, many Americans do not have access to adequate healthcare due to factors such as economics, geography, and lack of insurance coverage. This has led to increased interest in developing more accessible and cost-effective models of healthcare, including telemedicine and online healthcare. In addition to these challenges, the U.S. healthcare system has also been characterized by political turmoil and disputes. The debate over healthcare in the U.S. has long been characterized by conflicting political priorities and ideologies. One thing that many may not be aware of regarding the U.S. healthcare system is that there are significant differences in the quality of healthcare offered, depending on where in the country one lives and what type of health insurance they have. While the U.S. has some of the world's most advanced medical facilities and technologies, there are also significant differences in access to healthcare services and the quality of care offered. Many of these differences are due to geographic and economic factors, which can affect the availability of healthcare services in different parts of the country. It is difficult to provide a comprehensive picture of the quality of healthcare in the U.S., as this can depend on several factors and variables. However, there are some general trends and indicators that can provide insight into the differences between different states when it comes to healthcare. According to a study published by U.S. News and World Report in 2021, Massachusetts, Connecticut, and Utah are among the states with the best quality of healthcare in the United States. These states score highly on indicators such as access to healthcare services, quality of care, and preventive measures. On the other hand, the same study shows that Mississippi, Louisiana, and Alabama are among the states with the lowest quality of healthcare in the United States. These states score low on indicators such as access to healthcare services, quality of care, and preventive measures. It is worth noting that such rankings and studies do not provide a complete overview of healthcare in a given state, and there may be variations within each state. It is also important to note that healthcare can vary depending on different population groups, including minorities and low-income families. Another factor that affects the quality of healthcare in the U.S. is the type of health insurance one has. While some Americans have access to high-quality health insurance through employers or private insurance companies, many others do not have this luxury and must rely on public insurance programs such as Medicaid and Medicare. Differences in coverage and availability between private and public insurance programs can affect access to healthcare services and the quality of care offered. Another challenge in the U.S. healthcare system is that the costs of healthcare are often higher in the U.S. than in other developed countries. This may be due to a range of factors, including high administrative costs, inefficiencies in healthcare, and high costs of medical technologies and drugs. Finally, it is also worth noting that the U.S. healthcare system has a significant economic impact on the country as a whole. Healthcare in the U.S. accounts for a significant portion of the economy, and healthcare expenditures are one of the largest expenses for both private households and the federal government. This makes the healthcare system an important factor in many economic and political decisions in the U.S. It is difficult to identify a specific time when the U.S. healthcare system was at its best, as there have always been challenges related to access, quality, and costs. However, there have been some periods in U.S. history when the healthcare system has experienced significant progress and improvements. One of these periods was in the mid-20th century, when the federal government and employers began to offer health insurance as part of employee benefits. This helped expand access to healthcare for many Americans, especially in the working class. Many experts and analysts point to the 1960s and 1970s as a time when the U.S. healthcare system was relatively well regulated and accessible to a larger portion of the population. However, in the last 20 years, the American healthcare system has experienced a number of challenges and changes. One of the biggest changes was the introduction of the Affordable Care Act, ACA, also known as Obamacare, in 2010. The ACA aimed to expand access to healthcare for millions of Americans who previously did not have health insurance. It also made it illegal for insurance companies to deny coverage to individuals with pre-existing conditions. However, the ACA has been subject to criticism and political controversy since its introduction. Some argue that the ACA has led to higher healthcare costs and reduced access to healthcare for certain populations. Additionally, the ACA has faced resistance from political conservatives and has been subject to several legal challenges. Another change in the last 20 years has been an increase in the opioid crisis, which has led to a rise in overdoses and deaths related to opioid use. This has led to increased focus on treatment and prevention of addiction and overdoses. Finally, the economic impact of the healthcare system has become an increasingly large problem in the U.S. in recent years. Healthcare expenditures make up a large portion of the U.S. GDP, and the costs of healthcare have increased significantly in recent years. This has led to an increase in the number of people who cannot afford health insurance or healthcare services, and has led to political debate and discussion about what can be done to reduce costs and improve access to healthcare for all Americans.